Welcome everyone. This is Dr. Edward Kondrot, and today's webinar is Overcome Your Potential Genetic Weakness and Maximize Your Genetic Strength. And that's quite a mouthful, and hopefully by the end of the webinar you'll understand exactly what I'm talking about. This is something very, very exciting for me, and I think this is going to really revolutionize the way I approach nutritional supplements, vitamins, and counseling patients when they do have chronic disease. And not only is this going to change the way that I advise patients, but I believe it's also going to help people really get better results, and it is going to put them on the right path, not only for their general health, but also for their vision. Now, the very vitamins that you are taking might be causing great harm to your health. This was a big discovery that I had. There is no one vitamin or one protocol that's going to fit everyone. One person's medicine could be another person's poison. The other thing is that you are able to prevent bad genes from expressing themselves. This is exciting. So even if you have a strong family history of diabetes, glaucoma, macular degeneration, that does not mean that you will get that disease. Even if you have that genetic makeup in your body and you do have the gene that causes diabetes, macular degeneration, or glaucoma, it doesn't mean that you have to develop this problem. We now have ways to prevent genes from the bad genes from manifesting themselves. This is really exciting. In my appreciation for those of you that are watching this webinar, we have two special bonuses. 50% off the Fitgenes program. This is very exciting. Those of you that are watching who are members of the Kondrot program, who have gone through the boot camp in the Kondrot program, you will get the Fitgenes genetic profile at no additional cost. So that's kind of exciting. I feel so strongly about this program. Also, I'm going to give you a free report, Overcome Your Potential Genetic Weakness and Maximize Your Genetic Strength. This was an interview that I had with Paul Beaver, who's the president of Fitgenes. I got interested in this whole idea of genetic testing when I read an article that vitamins may backfire. There was a national study done in 2001 that looked at close to 5,000 participants aged 55 to 80, and they were looking at the effect of vitamins on the progression of macular degeneration. And this is the nutritional ingredients that they used. And this is not really a great formulation. And most naturopathic doctors and alternative doctors will kind of chuckle and smile. But anyway, this is what they used in the national study. And these are the results. That if they just used antioxidants, there was a 17% risk of reduction. If they just use zinc, there was a 21% risk reduction. Combining antioxidants and zinc, there were a 25% risk reduction. So this is phenomenal. This study then kind of got ophthalmologists interested in using vitamins to prevent the progression of macular degeneration. Very, very important study. Let's see here. Now, there was another article that came out that there is a subgroup, well, let me go back. There's a subgroup of patients, a genetic SNP based on CFH and ARMS2, that this group, by taking zinc and antioxidants, you may actually increase your risk of developing macular degeneration. Now, when I first read this study, I said, oh, this is just big pharma reporting on, another fact that vitamins can harm you. But then I began to think that, in homeopathy, we treat the individual. So maybe, a standard vitamin formula may not be the best thing for everybody. So let's look at the genotype. The genotype is the genetic constitution of an organism. It determines the hereditary potential, and I have to underline that, potential. That doesn't mean that it actually has to be expressed. There are things we can do to prevent the expression. So in this study, they looked at two groups of genotypes: complement factor H, CFH, and the age-related maculopathy susceptibility 2, the ARMS 2. Both of these are highly linked to macular degeneration. So for patients with high CFH and low ARMS 2, who made up 13% of this study group, the risk of progression to advanced macular degeneration within 7 years was 135% higher if they were in a supplement group. Now that's kind of scary, because we're not talking about 1 or 2% of patients. We're talking about 13%, 1 out of 10. So I was thinking, my goodness, that means that 1 out of 10 patients, and I'm telling them to take vitamins, I may actually be harming them. And, the first part of the Hippocratic Oath that every doctor takes is to do no harm. And certainly, I never want to do anything to a patient that actually increases their risk for any disease. And so let's go here. This is the summary of the results, looking at the genetic breakdown. So Dr. Carl O., who I interviewed on Healthy Vision Talk Radio recently, and you can go to the website to hear that interview, he felt that this is a potentially huge public health impact. We really got to reevaluate the nutritional supplements and vitamins that we're taking. As I mentioned, the homeopathic philosophy that I have practiced for over 20 years, we need to treat the person, not the disease. One treatment for one disease never works, and that's the limitation with conventional pharmacology. One blood pressure medicine is not going to work for everybody. Same thing with one diabetic treatment. We got to treat the individual. So this could be a problem with using disease-specific vitamin formulas. And this is really not new. There was a book published in 1956 by Dr. Roger Williams, Biochemical Individuality, the Basis for Genotropic Concept. And he stated if you have 20 people in the room, there'll be a 7-fold difference between the high and low nutritional needs. And that's shocking. So when the government comes up with a recommended daily allowance, that's a joke. Because even 20 people, there's a 7-fold difference between the need for vitamin C, zinc, any antioxidants, any nutrition. So his study even solidifies this fact that you need to look at the individual. Now, some of the genes that we look at, or we know, there's a gene called MTHFR, methyl tetrahydrofolate reductase. And this is a genetic SNP, and many people have a defect in this, which makes it difficult for them to detoxify their body. I did a study with Dr. Dorothy Merritt. We did some genetic testing, and we treated a group of macular degeneration patients, and every one of them had this methylation defect. And some studies show that 45% of the population had this methylation defect. If you have this methylation defect, you need to take more B-complex vitamins and methylfolate. There's another genetic SNP, APOE, which is linked to cardiovascular disease. If you have this genetic defect, this SNP, you need to make some dietary changes and exercise because you're at high risk for cardiovascular disease. Another one is NRF2, which is a genetic SNP that kind of turns on all of the defense mechanisms of the cell. So if you have a defect or this genetic expression is not working, you are going to have a very poor defense in your body. You're going to be more prone to infection. So believe it or not, we can actually turn these SNPs on and off to regulate your health. And one of the products is sulforaphane, which is made from broccoli sprouts, which has been shown to turn on that one SNP that kind of regulates our defense. There have been studies done. In fact, there's over 100,000 studies done every year. That's right, 100,000 studies done every year looking at this connection between nutrition, vitamins, and gene expression. In fact, it's now a science called Nutrigenomics. So because of this interest, I decided I got to go to the top place to get training. And believe it or not, it is in Australia. Brisbane, Australia is the corporate headquarters of Fitgenes. They're one of the largest companies that are now actively doing genetic testing, a very, very comprehensive genetic testing program. They have a proprietary computerized approach, so they can look not only at the genetic defect, but then they can also look at what you need to do to correct it. So that's the biggest problem with a lot of companies. You see you have a problem, but what are you going to do? And this computerized program is based on many, many different research articles. So there's a picture of my wife and I in Sydney, Australia. We had a wonderful time there. It's a beautiful country, and we had the pleasure of going to the Sydney Opera House to see Madama Butterfly. And here's a picture of me with the president of Fitgenes, Paul Beaver. Paul was very, very impressed that I traveled halfway around the world, or actually all the way around the world, to study with him. And after the intensive workshop, I became a certified Fitgenes practitioner, and there's only a handful of us in the United States that are doing this advanced genetic testing. So as you know, health is not everything, but without health, everything is nothing. Our health is important, and we really need to do everything we can to ensure that we are preserving our health and we're doing the right things for our health. So the one-size-fits-all model for healthcare is outdated, and gene profiling offers the ability to address the individual healthcare needs. And this personalized treatment is based on scientific processes. So it really isn't based on one study. It's not based on one doctor's opinion. It is based on hard scientific data. When we look at the genetic makeup, we look at the particular gene SNP, we're able to accurately advise you based on thousands and thousands of studies that have been done. As I mentioned, my interest in this developed because of the national study that was done that showed that 13% of the patients who are taking vitamins for macular degeneration, it may backfire. So what is one person's medicine is another person's poison. So in the Fitgenes profile, the genetic profile that we do, we look at risks for diabetes and insulin resistance. We look at cardiovascular health, fat metabolism, and weight management. This is interesting too because some people are on diets and exercise programs that may not be the best fit. And by looking at your genetic profile, we can immediately tailor a weight loss program that will be beneficial for you. And of course, obesity is one of the leading causes of poor health in the United States right now, a contributing factor to diabetes and heart disease. So that's one area that everybody should consider. Your bone health. As we know, when we get older, we get osteoporosis, and as the bones get soft, lead and other toxic products that are stored in the bone is released to the body. Hormone regulation is essential, and we need to look at our diet to make sure we're taking the right precursors to various hormones. Thyroid function, sleep patterns, relief from pain. reducing inflammations, finding out what genotypes cause inflammation, healthier aging, menopause balance. I interviewed Dr. Cheryl Selman yesterday on my radio show, and she made a really big point that taking estrogen is not a simple solution for postmenopausal imbalances, that she routinely does the Fitgenes profile, and sometimes just some vitamins and nutrients are all that is necessary without taking the estrogen supplements. And of course, hypertension and blood pressure problems. How are we going to address these? So Nutrigenomics is a new branch of nutritional medicine. It studies the effects of food on gene expression. And the research is done by focusing and identifying and understanding this molecular interaction between nutrients and the gene. And to me, this is very, very fascinating because I think it's going to enable individuals to achieve a greater level of health. It's going to empower you. So once you know your genetic profile, you'll be able to know exactly what needs to be done. So let's look at your genes, diet, and weight. Some people need saturated fats, others should avoid it. So the question is, how much saturated fat can you tolerate? What is the percentage of total fat that you can tolerate? What is the percentage of carbohydrates you can tolerate in your diet? Are you genetically prone to overeating? So the Fitgenes profile determines this, and then we're accurately able to prescribe for you a diet, which is the proper balanced diet that you need. Some people need a lot more saturated fats. Others have to avoid saturated fats. The same thing with carbohydrates. So as you age, are you genetically predisposed to poor glucose control, insulin resistance, becoming diabetic? Believe it or not, we can turn off some of these genes that are making you more predisposed to these problems. Did you know that losing just 10% of your body weight can add 10 years to your life? And it is estimated that 75% of health and life expectancy after the age of 40 is modifiable by losing weight and also by looking at turning on the right genes and turning off the bad genes. There's no question that obesity is one of the number one health issues in our country. And environmental factors and lifestyle factors contribute 30% to a person's body weight, but genetics contribute to the other 70%. So most of us are tackling the environmental and lifestyle factors, which are 30%. If we look at the genetics, then it's going to be a lot easier for us to improve our health, lose weight, and reduce obesity. So your genes influence diet, exercise, hormones, inflammation, liver function, toxicity levels. So wouldn't it be nice to know your genetic profile so you could make the right changes to have kind of a blueprint to help you with your health? So your genetic playing field is this personalized genetic profile. And we just don't stop there. It's important that we work with you over a 12-week period to address all your healthcare needs. So I think after 12 weeks, when we monitor your diet and your nutritional supplements and your vitamins, I think after that, then you'll be pretty comfortable in knowing what you have to do to continue. So you need to be coached. So the Fitgenes Fast Track, which I am now incorporating in my office, is a fast track to health, and it's an integrative healthcare solution. These are the steps right here. Step 1, you book an appointment. We discuss your specific health requirements. What are your current problems? What are your goals? And we'll outline a program in detail. Then we take a sample of your DNA, and this is not a blood sample. We just scrape the inside of your cheek with a swab, and we send it to a laboratory. Once we get your comprehensive genetic profile, Then we'll process a customized 12-week treatment plan. We'll go over all your genetic results. We'll talk about what dietary changes you need, what supplements you need to take, what changes you need in your exercise pattern, and then we're going to follow you over 12 weeks to make sure that you're sticking to this program and you're getting results. We want to go back to step one and find out what your initial goals were, and we're going to make sure you achieve those goals. So the program has measurable results. Increased levels of energy, vitality, weight loss, and clarity that you will have what it takes to maintain a healthy life. That is very, very important. And of course, those of you that are listening that have vision problems, we want this to be a key to help you determine what is missing on your journey to achieve better vision. So this is a sample. There's well over 50 some different genetic SNPs, and each genetic variation has a marker: normal, less beneficial, least beneficial. Of course, we're looking at the ones that have least beneficial, the red ones. So this is my test right here, and this is inflammatory markers, and you can see I have 2 red dots by those inflammatory markers, and I wasn't too happy about this, but it tells me exactly what I need to do. I have to increase the alpha-3 omega oils. Although it's marked fish oil here, you know, those of you that know me, I'm not a big proponent of fish oil. I like the plant-based oils. I also have to increase the alpha-linoleic acid. I also have to take an SOD inducer, and that's superoxide dimutase, which is an antioxidant. And I need more vitamin D3 and sulforaphane, and some other ingredients down the line here. But, so I kind of have a blueprint what I need to do. Also, my vitamin D receptors are moderately decreased. So I want to look at those, and sulforaphane is what I need. I don't need to take more vitamin D3, you can see here. I got to take sulforaphane for that. So this is just a small example. Also, we look at your diet. You know, the best diet for me is the Mediterranean style diet. I have to increase the ratio of alpha-3 or omega-3 to omega-6. Decrease fatty acids. Fatty acids are not good for me. So I have to cut back on the fatty acids I'm consuming. Fish is good. I have to decrease saturated transhydrogenated oil. Increase fruit and vegetable intake. So this is just, you get a 38-page report, and we kind of distill it and we make the recommendations for you. More information. Healthy weight. So one of my goals is I'm a little bit overweight. I got to knock off the weight. I should avoid smoking and passive smoke. Well, I'm not a smoker, but tobacco smoke does really bother me. Reduce alcohol consumption. Thank goodness for this. I like my red wine in the evening, so that's really not a factor. Adequate sleep, stress management, etc. Cardiovascular health. There are 4 categories of exercise: leisure time walking, aerobic, resistance, avoid overtraining. So for me, aerobic exercise is most beneficial. And some people, it may be leisure time walking or resistance exercise like weightlifting. But I love to take my morning run, and my Fitgenes profile tells me that I should continue that. That's going to be good for my health. So let's talk about this Fitgenes 12-week program. Your investment is $2,995, and it includes the following. You have an initial consult to discuss your goals. You complete a comprehensive health questionnaire, so we know exactly where you are in your health and what your goals are. You get the comprehensive genetic profile. We review your lifestyle, nutritional, dietary, and vitamin recommendations provided based on the genetic profile. Then we recommend You'll have a 6-week consult and a 12-week consult to see how are you doing on the program, if we have to make any additional changes based on your initial goals. At the end of the 12 weeks, you're going to repeat your health questionnaire, and hopefully there's going to be a dramatic change. You may need additional lab studies, nutritional products, and vitamins, but they're not covered by the program. But I don't want you to become dependent on a shopping bag full of vitamins. So most of the recommendations are going to be dietary, exercise, healthy recommendations. There may be a few supplements, but it's not a strongly oriented supplement program. Now we have a special offer. This is for existing patients. If you have had an exam with me the past year, the offer is $1,495 investment for the Fitgenes program. That's a savings of over $1,500. If you're not a patient and you say, boy, I want to take advantage of this, then you need to have an examination. So you have to become a patient. And this offer expires on May the 30th. So this is all the benefits that are in the program, special offer. Now, if you are an active member of the Kondrot program, there is no charge for the Fitgenes program, so you can't beat that price. So if you have done the Kondrot program, you've gone through the boot camp and the year program, call the office now and we can get you started on the Fitgenes. So I'm opening up the lines for questions. So let me see here. There's a couple of ways that you can communicate with me. One is you can kind of, your control panel on the right or left, you can raise your hand. If you raise your hand, I'll unmute you so you can talk to me, because there's quite a few of you on this call. Or you can type a question, and then I'll answer it. So I'm opening up the lines for questions, and I really hope that you take advantage of this program. I think this is going to be an important factor for your key to success. And certainly if you're involved with the Kondrot program, if you participated in the Kondrot program, we are offering you this program at no charge. So give the office a call to get more information. And let's see. Question right here. I'm working right now on filling out the supplement list on the questionnaire. It wouldn't allow me to add any more lines for supplements. Well, my goodness, you're probably taking more supplements. So I would just leave those lines blank. And then when I talk to you, we can then go over that in more detail. Can the methylfolate defect testing differentiate between heterogeneous versus homogeneous gene problems? And yes, it can. It can determine the difference between the heterogeneous and the homogeneous problems. So it does give subgroups of each genetic SNP. Let's see. So remember, now there's two ways. You can raise your hand, click your hand button on the control, or you can type a question. Question is, are there any teaching Fitgenes program that you're going to conduct? Well, I had a long conversation with Paul Beaver, the president of Fitgenes, and we are planning to have maybe a Fitgenes workshop here in the United States. And if you're interested in that, make sure you sign up for my newsletter, that you're on my email list, and we'll be keeping you up to date. Also, there are probably 3 or 4 Fitgenes practitioners right now in the United States, and we may be having a meeting together, and we may be opening that up to the public for patients to come so we can educate them. The question is, what is the eligibility? Well, the eligibility is for everyone. Everyone can get the Fitgenes profile. It's it's painless. All you do is just do a scraping of your cheek. The eligibility, I maybe you were referring to what the cost of the program. So we are offering a substantial discount right now to the end of May, and even a greater discount if you're a member of the Kondrot program. Another question is, I did a 2-day session with you. Well, the 2-day session is not the Kondrot program, but we still will honor the discount, and you don't have to pay an additional $500 for a patient. So the cost there will be $500 or $14.95. There's a question about macular pucker. That is a detailed question, and I don't want to go into detail about treatment of the macular pucker. I would suggest that you go to my webinar on my homepage, healingtheeye.com, and watch that. But there are things that we can do to help that. Okay, the patient mentioned that they do have a methylation defect, mutation. Well, the Fitgenes program will give you the dietary recommendations, exercise programs, etc., based on over 100,000 different articles that are studied. So just because you have a defect, gene defect, we can still help you and try to do the things so we will turn off that gene to make you healthier. You mentioned this type of information a couple months ago, that initial test of our genes. Well, we're doing 2 genetic testing. One is for the particular SNPs for macular degeneration, and the Fitgenes program. The Fitgenes program looks at more of health factors. So it's not going to diagnose if you have hemophilia or you have some kind of genetically inherited disease. It mainly looks at inflammatory markers, oxidative stress markers, detox markers, absorption markers, that type of thing. Does Fitgenes have a genealogy component? No, it does not. It does not have a genealogy component. Do we have to come to Florida, or can this be done by phone? Well, we'd love you to come to Florida, but it does not have to be done here. If you're an existing patient, which you are, Miss Dottie, all we have to do is just mail you the profile, and then you can get it done. And the program can be done in Boston. You just contact our office, and we'll send you the paperwork, we'll send you the test, and then we'll submit it. And all of the follow-ups, all of the consultations can be done over the phone. So the program can be done without coming to Florida. That's what makes it really beautiful. A blood test is not needed. All you have to do is be able to scrape the inside of both your cheeks about 30 times with a swab. You put it in a specially sealed envelope, you send it back to us, we send it to the lab, and in 1 to 2 weeks we give you a phone call and we do that first initial consultation. So anyway, I want to thank all of you for participating. This has certainly been, really, really exciting for me. I think this is going to revolutionize the way I look at disease. The Fitgenes genetic profile is now standard for the Kondrot program. Those of you that will be signing for my year program, this is a standard treatment. And those of you that have done the program in the past, I am offering this to you at no charge because I think that this is a very, very important component. So I want to thank all of you. If you have any additional questions, please give the office a call. The number is 800-430-9328, or email us at info@healingtheeye. And remember, we do these educational webinars the first Monday of every month, If any of you have some suggestions on topics you would like me to discuss, please give the office a call and we can take care of it. So thank you so much for attending. This is Dr. Kondrot wishing everyone good health and clear vision.